Prime Minister, Donald Trump said pretty clearly that the US has some evidence that the coronavirus originated in a lab in Wuhan. How seriously do you take that comment, and how seriously will you be pushing at that as an option in the review that you've flagged? And perhaps a separate question for Minister Colbeck. How concerned are you by the high infection rates and fatalities at the Newmarch house? And will the residents there who can't go to hospital still get access to ICU care and ventilators?
Look, on the first one, what we have before us doesn't suggest that that is the likely source. There's nothing that we have that would indicate that was the likely source. Now, you can't rule anything out in these environments. I mean, we know it started in China. We know it started in Wuhan. The most likely scenario that has been canvassed relates to wildlife wet markets, but that's a matter that would have to be thoroughly assessed. This is one of the reasons why it is important that we just have an objective, independent assessment of how this originated and learn the lessons from how that occurred. It's, I think, an entirely sensible suggestion. It's one that has broad-based support. It's one that is being recommended by the European Union to the World Health Assembly. It's one that a recommendation will be supporting and speaking to, and we think that's really necessary. But in terms of what we understand, in terms of the origin of the virus, while that can't be ruled out, it's not something that we've seen any hard evidence of to suggest that is the position. But that's where it sits right now. But Richard, on the other matter.
Thanks. And look, a question that's been of concern in the community from a number of perspectives, and PM and I certainly extend our sympathies to the 13 families that have lost their loved ones so far. All of the residents within the facility are getting very high quality care. We're operating what's called hospital in the home, and that's being facilitated by the local public health unit, PHU, from Nepean Health. All of the residents, I'm advised, have end-of-life plans that they're being cared in accordance with, and so they are getting the care that they have prescribed within those plans, and we're effectively running a mini hospital within the facility. There are doctors there on site all the time. There are a very large cohort of nurses there, as well as the normal care workers, and so there has been no limit on the resources made available to Newmarch in managing this, particularly since we took the actions that we did last week. Can I say we're all very concerned at the number of people within the facility that have contracted the virus, but as Professor Murphy indicated to me last week when we talked about it, this is what happens when you have somebody with a very high viral load in contact with people who have other comorbidities and are very frail for a considerable period of time. And this is not a finger-pointing or a blame exercise. It's a very, very unfortunate circumstance where somebody who was asymptomatic but obviously had a very high viral load was in contact with people for 6 days, residents and staff, and this is the very, very tragic outcome of that. But we are doing everything we possibly can in accordance with the end-of-life care directives of all of the residents at the facility. There is one resident who's in hospital with, I think, a broken ankle, so not necessarily related specifically to COVID, but they are all getting, by benefit of the work of both the Commonwealth and the New South Wales Government, who lead on public health, the very, very best care.
You were hook up last night with Mel?
Yeah, I did a webinar with a number of the families with Melissa McIntosh, the local member. There's been a couple of webinars that have been conducted with the residents and some of the public health professionals that are involved from particularly Nepean Health, and the Aged Care Quality and Safety Commissioner was on the call with me last night in the discussions with the families, and also on another webinar that was run by Newmarch itself Friday of last week with some of the infectious disease health professionals that are assisting with the management of the outbreak within the facility.